The St. Joseph Family Medicine Residency Sports Medicine program is active in the Metro Milwaukee community. The physicians of the Medical College of Wisconsin work with athletes from local middle and high school sports teams, as well as a variety of members of professional sports teams like the Milwaukee Brewers, the Milwaukee Wave, the Milwaukee Ballet, and Cashel Dennehy Irish Dance.
When an ankle injury comes into your office, the decision must be made whether to treat it as an ankle sprain versus an ankle fracture. You can use your examination and the Ottawa Ankle Rules to help differentiate whether you want to treat this as a sprain or you want to do other examinations like an x-ray if you're suspicious for a fracture. Some things that can help you is a good history initially. You want to know, where was the athlete when this occurred? What was the position of the ankle when the injury occurred? Was there initial swelling and ecchymosis or bruising? What was the position of the ankle? Was it an inversion versus an eversion injury? Was there any numbness, tingling, weakness? Did the athlete feel a pop? After you've gotten a good history and done some neurovascular testing, range of motion, and some initial inspection, you can segue into the examination. The first thing you want to do is take a look at the ankle. I like to start my examination on the contralateral side of the ankle. You want to feel around the ligaments. The most important ligaments for an ankle sprain is the lateral ankle ligaments that come off the lateral malleolus. So when evaluating for an ankle sprain, the three most common ligaments that are injured are the anterior talofibular ligament, the calcaneal fibular ligament, and the posterior talofibular ligament. These are the three most common ligaments that are injured in an ankle sprain. You want to start by pressure testing over these ligaments for tenderness. Test over the anterior talofibular ligament, the calcaneal fibular ligament, and the posterior talofibular ligament. Now, in differentiating between an ankle sprain versus an ankle fracture, you need to find out if there's any bony tenderness also. Some areas of interest will be the posterior lateral edge and tip of the lateral malleolus. So you're going to feel for tenderness there. The base of the fifth metatarsal, the posterior edge and tip of the medial malleolus, which you can come down here, and your navicular bone. Any tenderness in these areas, along with tenderness over the ligaments and the inability for the athlete to have walked 4 steps at the location of the injury or in your office or emergency department, is more suspicious for an ankle fracture, and an x-ray should be gotten. Treatment for fractures are usually a cast or a walking boot. So in evaluating an ankle sprain, the three most common ligaments that get injured are the anterior talofibular ligament, the calcaneal fibular ligament, and the posterior talofibular ligament. If there is tenderness over any of these ligaments, it is suspicious for an ankle sprain. An athlete incurring a sprain should be able to bear weight for at least 4 steps immediately after the injury and at the emergency department or the office. They should be tender with range of motion stressing of the ligaments in the area of injury and have tenderness to palpation of these ligaments. Edema and ecchymosis of the area are also common. Treatment for acute ankle sprains follow the acronym PRICE: protection, rest, ice, compression, elevation, followed later by range of motion and balance exercises.
History. Athlete location. Ankle position. Presence of swelling or ecchymosis. Inversion versus eversion. Numbness, tingling, or a pop. Examination. Pressure test lateral ankle ligaments off the lateral malleolus. Anterior talofibular ligament. Posterior talofibular ligament. Calcaneofibular ligament. X-ray indicators. Tenderness off the lateral malleolus. Inability to bear weight for at least 4 steps immediately or at the office. Bone tenderness over posterior lateral edge and tip of the lateral malleolus. Base of the fifth metatarsal. Posterior edge and tip of the medial malleolus. Navicular bone. Edema and ecchymosis of the affected area. When not to use the Ottawa Ankle Rules. When the patient is younger than 18 years old. The ankle injury is one of multiple injuries involved. The patient is pregnant. The patient has other health problems that compromise neurovascular status.